afternoon, everyone. I'm Stephanie Rayberg, OSAP's Senior Marketing Coordinator. Welcome to today's session titled Clearing the Air, Understanding Airborne Transmission of SARS-CoV-2, Air Quality and Viable Control Methods for Dental Offices. I'm pleased to welcome Ms. Nancy Dewhirst, who will introduce our speakers. Nancy presents interactive hands-on workshops as well as seminars that combine science and practical information nationwide. She's an adjunct professor at West Coast University Department of Dental Hygiene. If you have any questions throughout the session, please add them to the Q&A. If time is left at the end of our session, our speakers will address them. Now to you, Nancy.
Thank you very much, and welcome everybody to Clearing the Air. This session is an hour and 15 minutes. I have no relevant financial relationships to disclose. And again, please post your questions in the Q&A and we'll be addressing those at the end. So as a little background, OSHA has categorized dentistry as very high risk, as we know, but they cite these specific reasons, and we'd like to address some of them today for you. We work in enclosed spaces for prolonged periods of time. We work in close proximity to each other and our patients. We work in a world of aerosols and droplets, and COVID-19 is transmitted efficiently by asymptomatic carriers. We can no longer think we can screen them out. We've got to deal with it. And this is an aerosol transmissible disease. So there are a lack of indoor air quality management available to us that we know about. And many of us think that there are lacking guidelines as well. So also the effectiveness of the ventilation strategies that are in place are unknown. Those are the reasons OSHA says we're at high risk. So today we have the opportunity to look at some information from experts outside of our immediate world. The learning objectives for today are to explain why aerosol transmissible SARS-CoV-2 or aerosol transmission of SARS-CoV-2 is the dominant pathway over other modes of transmission of respiratory viruses. To understand how ventilation beyond 6 air changes per hour reduces indoor long-range transmission of SARS-CoV-2, to discuss how scientifically proven filtration methods dilute or improve indoor aerosols, and to understand options to implement viable air filtration solutions and controls using existing technology. Today we get to hear from 3 experts, Dr. Kimberly Prather, and Dr. Shelley Miller, and Don Vaniman. Kimberly studies the measurement and analysis of aerosols in a variety of forms. Dr. Miller studies building ventilation and filtration to reduce airborne disease transmission. And Don Vaniman designs equipment for air movement, filtration, and purification. So we're going to start with Dr. Prather. I'm going to go ahead and read the introduction for all of them at the beginning, so there'll be less flipping back and forth. So Dr. Prather is the Distinguished Chair in Atmospheric Chemistry and Distinguished Professor at Scripps Institution of Oceanography and the Department of Chemistry and Biochemistry at the University of California, San Diego. She is the founding director of NSF Center for Aerosol Impacts on the Chemistry of the Environment. Her research involves understanding how aerosols impact climate, air quality, and human health. Her group focuses on identifying the source and transport pathways of airborne viruses such as SARS-CoV-2, as well as bacteria and other pollutants. During the COVID-19 pandemic, Professor Prather has been actively communicating the science of airborne transmission of SARS-CoV-2 and has given many media interviews. She's an international leader in inducing policy changes to better protect against the spread of this airborne virus. She's also been involved as an expert in developing safe plans for reopening of schools, including San Diego Unified School District and UC San Diego. She has received numerous awards for her work, including being an elected member of many prestigious scientific academies and organizations. That sounds like a long introduction. I had to way cut it. So go to her website. It's amazing. Dr. Prather will be our first speaker. The second speaker is Dr. Miller, and she is a professor of mechanical engineering at the University of Colorado, Boulder, and a faculty member of the interdisciplinary environmental engineering program at CU. She researches indoor air quality, urban air pollution, health effects, air pollution mitigation, control of airborne infectious diseases, and the development and evaluation of indoor air quality control measures. Her current research includes assessing and designing engineering controls such as filtration and ultraviolet germicidal irradiation. Dr. Miller investigates the health effects of outdoor and indoor air pollution, coarse and ultrafine particle contamination, and our focus today, the microbiology of the built environment, studying how HVAC systems play a role in infectious disease transmission. Visit her website to link to the long list of published articles, most recently focused on SARS-CoV-2 transmission. Some examples are Dr. Miller's investigation and report of the Skagit Valley coral super spreading event, as well as comprehensive study on indoor air quality in public schools. And our third speaker is Don Vaniman, a mechanical engineer and president of Vaniman Manufacturing Co. So for 25 years, Don has been responsible for research, design, and development of products to provide clean air and safer work environments, specifically for dental offices, clinics, schools, and laboratories. Don's team now creates products that are used internationally in aerospace, government, education, jewelry, and manufacturing as well. So they've grown. Long before the start of COVID-19, Don Vaniman and his company had been working in these different industries to remove particulates and contaminants in the workplace. Today, Don brings us new research results addressing the application of mechanical air filtration, aerosol capture, and ventilation devices to address COVID-19 airborne transmission in dentistry. Today, we'll learn about solutions to airborne risks that are immediately available. So he's sort of the link of the mad scientist. So we're going to start out with the mad scientist. Dr. Prather will now detail how we know COVID-19 is airborne and how once we acknowledge that, it becomes a fixable program. Dr. Prather?